Hey everybody, Dr. Joe Bafile here. Another episode of Abundant Health Naturally, and again, our wonderful special guest, Dr. Phyllis Russo, and an awesome opportunity to connect on the topic of fibromyalgia. Dr. Phyllis Russo, Dr. Dash Live Well, fibromyalgia. Wow.
Which pretty much presents, hello, by the way, which pretty much presents the same as Hashimoto's. The biggest difference is it's interesting because if you look at like some old information, they don't list it as autoimmune, which is pretty funny. And part of the reason why they don't is that there's really no lab test. You know, I used to remember the days where it was like, oh, just tell them they have fibromyalgia or chronic fatigue. Now they give us initials, CFS, FM,
Right.
which gives it a little bit more credibility. But they still don't have the answers for why, because generally there is no lab work attached to it, right? It doesn't show up as RA. It doesn't show up with the antibodies of Hashimoto's. It doesn't show up. Well, there are some antibodies that might show up in the brain, but those are specialized and expensive tests. So people don't always get that.
I don't know about you, but I have always been taught that with fibromyalgia, the only thing is a palpation test of 18 points on the
Right.
body. And if you have 11 of the 18, you have fibromyalgia. Oh my goodness, almost everybody I talk to or see in our practice, as you see in the background here, this is our therapy suite where we do cold laser, decompression, ultrasound. So these are different things that we utilize to help these people. But, you know, it's sad that people are dealing with many different things. And I guess my biggest question is, who's affected? Who is affected by fibromyalgia? And we have to open that up because a lot of people can think, well, I have fibromyalgia, or I have knee pain, or I have migraines because they experience headaches.
Yeah,
Everybody's different.
true. I mean, the one thing that will come into agreement is the percentage of women having fibromyalgia is like astronomically higher than men having
I have a
fibromyalgia.
statistic here. More women, 62% of the population,
Mhm.
women, compared to 38% men
I
dealing with.
think that's, you know what? I mean, think about your own practice. So I get it. That's a good statistic. I think it's more than that. I think that when the diagnosis of fibromyalgia, I mean, from my practice back in the days, I would say those who had fibromyalgia, honestly, how many male patients do you have that have fibromyalgia?
Very little.
I
To be
think I had,
honest with you, I mean, if
I
I
think I
wanted
had,
to dive into it, there might be one or two, but I have a lot of female
I
patients.
remember, yeah, I remember one. That's it. Compared to, of course, back in the day, they didn't diagnose Hashimoto's. They didn't do the lab work. But I would say those that were diagnosed with fibromyalgia, I probably had, I mean, remember, oh, hi. Remember, I didn't have like I'm adjusting, I'm adjusting, I'm adjusting. So I didn't see a lot of patients during the day. But so I would say I had maybe 50 fibromyalgia patients, and they were all women. One was a man. So that's number one. Like when we're looking as practitioners, when we're looking at like who's coming in the door and who's having fibromyalgia, they're women. Then the question is why? So it comes down to more, it's more hormonally based. There's probably genetics. Probably some of this is Hashimoto's without knowing that. Because it's all the same. It's almost the same presentation. There's more pain points in fibromyalgia. But that also depends on the age of the patient.
Mhm. Now, mostly when we're dealing with fibromyalgia, uh, fibro meaning the tissue, okay, and
Right.
myalgia meaning muscle,
Pain, muscle
okay,
pain.
muscle
Yeah.
pain. So, and that's where a lot of people get this misconception. It's joint pain, but it's really muscle pain. They're feeling pain within their muscles, and then the fatigue, because we talked about it, constant fatigue, chronic fatigue.
Hmm.
They're not getting their rest, so it's sleep disturbances, sometimes paresthesia, where they have numbness and tingling, and that's where the fibromyalgia people that deal with this, they're Western medicine doctors, allopathic doctors, they don't know how to search for it or look deeper because it's many different things all at
Right.
once.
And what do
And
they
that's
usually say?
what do they usually say? Uh, I don't know how to treat this. It's all in your head.
No, a doctor would never say that. A Western medicine doctor would never say that. They say it's all in your head. As a matter of fact, I think we want to title this podcast "It's All in Your Head" because that's exactly what is said. And do you know I can get that 20 years ago. I can get that maybe 15 years ago. They are still saying that. Now, is there kind of a psych component to it? I just read a study last night because I was looking some of this. I always go to Scholar Google. There actually is a correlation with certain childhood trauma
Promise, yes.
and fibromyalgia. Emotional trauma, not necessarily, they had a car accident. So I thought that that was kind of interesting that those two coincide.
So
So
I
there
have
is a
something
psych
here.
component.
Only 50% of the patients can identify a specific factor triggering fibromyalgia. Factors that may contribute are sustained symptoms include psychological stress,
Hmm.
arthritic conditions, so inflammatory issues,
Yeah,
biochemical abnormalities in the central nervous system, uh, which could be altered serotonin levels, again, affecting their sleep and their energy.
yeah.
Um, it's just amazing. But we can even go deeper. There's viral or bacterial infections that can
That could
affect
be the
this or
trigger.
trigger.
Yeah,
And a lot of my experience in the past with patients with it, again, we just touched on this, a psychological factor or trauma, like an automobile accident or a
right.
loss of a loved one or something more
Yeah,
deeper.
it can be both. Like it can be um, psychological, that type of trauma. But you're right. It can be a car accident. Now, car accidents are interesting because they're physical and they're emotional. Like that's a shock to your system. Because there's a lot of fear produced, a lot of cortisol gets produced, your cortisol goes up. And so that you're right, because it affects the adrenals, it affects, the brain patterns. And so it can also be a huge trigger, or if you have it, it can actually make it much, much worse. And honestly, again, that's when I was looking at it in that way of there's so many different symptoms, there's so many different triggers, there's so many different parts of the body. You mentioned the neuro part. I can't remember how you just said it. What did you say on the? I mean,
The
because
biochemical abnormalities of the central nervous system.
yes, yes. And so you're looking at neurotransmitters there and what's going on with them. Are we flushed with too much serotonin, too little serotonin, any of the other neurotransmitters? And that's, by the way, why they give psych medications like Prozac, because Prozac is an SSRI. That's why they give them these medications. But that isn't the whole answer. And that's one of the things I looked at last night is, all the different health gurus. What do we do with fibromyalgia? And every single one goes, we still have to go back to the mitochondria. We still have to go back to the cellular level. just like everything else, just like Hashimoto's, going back to the Krebs cycle,
Oh
you
dear.
know, our old
Just
Krebs cycle.
just had a flashback to biochemistry class.
Yeah. But NAD, one of the things that you can do with fibro is those patches, the iontophoresis patches of the NAD plus, because NAD is part of the Krebs cycle, goes it's for the mitochondria, and it starts to give us energy again. Once we have that metabolic increase in the mitochondria, even the pain can start going away. So here's the thing about what I love about fibromyalgia is there's so many different ways you can treat it that work or don't work. And yes, sometimes you have to go through the ones that don't work. Sometimes they work for a time and then they might not work again. And you don't have to treat every symptom per se or every body system of that symptom. Like foggy head is huge in fibromyalgia, but it's also huge in Hashimoto's.
Right.
So one of the first things you can do if you have fibromyalgia is check those antibodies for Hashimoto's. That's number one. I'm, believe it or not, I know this sounds like so against what I would say. There are some people that their lab work doesn't show the antibodies. It might not even show that the TSH or the free T3s are off, might not show it. If they have all the symptoms of Hashi's, you can call it fibromyalgia, but if they have all the symptoms, if I were a Western medicine doc, I might give them the drug anyway, the synthetic T3, synthetic T4, because I'd want to see if they get better. Just do it for 30 days and see if the foggy head goes away. Because believe you me, there are things, magnesium L-threonate is amazing for brain focus, amazing. But I wonder if it's still Hashimoto's without it showing up in lab work. I know that's against every principle I have.
So I like what you're saying, and the problem lies within the medical profession is they won't just try it for 30 days.
Well, they won't do it at all. I'll tell you why. It's not a standard of care. If it doesn't show up in the lab work, they're not going to give you the drug. So it's not going to happen anyway. And you're right. And it might be 60 days, but you're right. They won't even put somebody on the drug if it's not showing up on the lab work.
I mean, some of these simple medications that we have seen people be on during our professional careers, very few of their family doctors ever get them off anything. And that's why they call them a continuity drug, whether it's a statin, whether it's a diabetes medication, whether it is thyroid stuff.
Yeah. What about, God, I wanted to say Ozempic. I mean, omeprazole.
Proton pump inhibitors. Yeah.
You're only supposed to, those bottles have 14 pills in them. It's basically, it should be done as a reset. And people are on it their whole lives. And so now that's a whole other story, but now nobody has enzymes in their gut or hydrochloric acid in their gut because they've suppressed it with things like Prilosec day in, day out for years. They have no function anymore.
But see, that's the problem. We have a, quote, standard of care, but who is, how I say, policing that standard of care? Who is watching over that? Is that the drug companies? Is that the insurance industry?
Well, it's the insurance companies.
Right.
In actuality, it's kind of funny. We always talk about, God, we can get into a whole conversation about this, at least my opinion. We always talk about pharma and pharmaceuticals and how evil the pharmaceutical companies are. And I'm not negating that they're not evil, because they are. The bigger problem is the insurance companies, because the insurance companies rule the pharmaceutical companies. Pharmaceutical companies are making money hand over fist. but the ruler is the insurance companies.
Yeah.
And so that's who I think is running the show and the standards of care. Who makes the rules? Pharmaceutical companies don't.
Well, and that's why
They just want to sell it. The rule makers are concerned.
in the educational part of becoming a healer, a connector with people to help their bodies get better, it has become so prostituted, basically, if I can use that, to just do what what they teach you and never allow you to critically think outside of that
Right.
parameter, that box of things. And unfortunately, Phyllis, we're seeing that in our own profession as chiropractors, where they're having a tyrannical stance on how things are done, and yet we can't even reach people or get reimbursed as providers in the most right way. And just think about it. We could reach and serve so many more people in a way that would not bankrupt the medical part of things, but it would serve them better. And guess what ends up happening? All the things that you and I talk about here, and we've been talking about these things for years. And guess what's starting to trickle in to the medical community? The things that we have been talking about
For
and coming
35
out
years.
into these airwaves of
Yeah.
podcast and videos and so forth. They're getting the big idea that
Yeah.
the drugs aren't working. People are
Right.
dealing with these problems. They're not getting any better, and they're actually hurting in their own pockets. And that's why, my muscles are aching just talking about this. But
People, I mean, and I don't want to get political, but when RFK started running and I knew his background, I couldn't have been more pleased. Now, I don't think everything starts from the federal government down, but at least it's out there. The change is out there, and it's trickling in. People are hearing it. They can't help but hear it. Some of what he does is on the news, and so it gave me hope. All I can say is it gave me hope. Whether it goes in a fully direction that I'd like it to go in or you'd like it to go in, but at least and not only does it just give me hope, but it gives me hope for the world. I'm not going to be around. I don't think I'm going to be around that much longer, but the world is, and people are, and people that I love are, and people that I treat are. And so there's something there. There's something there for them. So I was going to say, I wanted to talk about a couple things in the way of fibromyalgia. You and I were just talking about the Healy, so I can talk a little bit about that. But one of the things I looked at last night, well, first of all, you tell me, because chiropractics, because there's a vagal response with fibromyalgia, because there's that neurological component, talk about chiropractics itself and fibromyalgia.
why do we ache all over when we're dealing with fibromyalgia? We've got decreased energy to the muscles,
So that's
which lead,
mitochondria.
yeah. So again,
Yeah,
we're going back to the cellular level.
right.
Muscles fatigue very easily, so they don't have to there's the hormonal aspect with the adrenals and cortisol. Uh, Muscles are abnormally tender, so there's more inflammation. And then what ends up happening, we use less of our muscles. So when we're not moving well, things get more sore. So
Exactly.
chiropractically, we evaluate where those restrictions are, whether it's a subluxation, whether it's a fixation, more than one area stuck not moving well. And then neurologically speaking, that nerve is being rubbed, pressure, irritated by inflammation or
Mhm.
lack of connection. That proper flow from above, down, and out to wherever it needs to go, and thus cellularly not getting those right signals. Um, the abnormal motion of that joint creating more pain. So chiropractically, we assess that area, we adjust the spine, we stimulate that muscle movement, whether it is through stretching, whether it is through electric stim, ultrasound, or our cold laser within our office. So we have many different ways or tools to
Yeah.
help approach this in the most right way. And it doesn't happen overnight because these problems didn't occur overnight. These things have been building up over a period of time. And unfortunately, we have patients that come in our door and they expect, "Hey, doc, I want to get cracked. I want you to crack me." Well, unless you're an egg, we're not going to crack you. And it's just a matter of having a standard of care that we even see within our chiropractic profession.
Yeah.
Everybody's different. I mean, we'll have
Well,
people go
especially
to
with fibrom.
yeah, and we'll have people go to a chiropractor and they'll get throw them right on the table without assessing them and finding out what's going on and coming up with a care plan, a standard of care for that particular person. So we find in our office having a standard where we are efficient and consistent with that, and we
Yeah.
get results.
And I think your assessment, I think, again, let me, I don't do chiropractic as much. I mean, I do with some people, but I mix it in with everything else. I will say, though, from the beginnings of chiropractic to now, I was never the chiropractor that said, okay, I'm going to adjust. Okay, I'm going to adjust. Okay. But you know what? It's still not it's not the worst thing in the world because the way adjustments work, they still work on that neurological connection basis. And so even the chiropractor that adjusts and lets them go and adjusts and lets them go and adjusts and lets them go, there's still incredible healing in that. And so even though it wasn't my type of chiropractic, I still believe very strongly I would way rather do that than somebody give me for fibromyalgia, let me give you an antidepressant. Because one, they think it's all in our heads.
Mhm.
And two, when you're on an antidepressant, it does change some of the neurology. It will maybe help the pain, but it doesn't always. So what else do? They give you a secondary drug for the pain, or they'll give you another drug for some other symptom. And so that is one of the reasons, again, on my program, you can have fibromyalgia on my program. It doesn't have to be called Hashimoto's because let me start talking a little bit about acupuncture. Acupuncture is a whole different kind of paradigm when it looks at fibromyalgia. Well, when it looks at any disease or whatever disease the Western world wants to call it, they look at it in the way of the energy that flows through you, what might be stuck, what might be stagnant, what might have too much flow. And so a lot of times with fibromyalgia is they call it chi stagnation, which is that ultimately, to put it in Western terms, it is that cellular stagnation. Like that's why NAD plus works so well because it actually helps that cellular stagnation. It kind of drives it through. But then there's liver stagnation.
Right.
Like a lot of fibromyalgia, ultimately, if you want to talk about the organ or the meridian or the lack of flow in the system, you're looking at liver. And that's a big one with fibromyalgia. And again, you want to look at everybody. You want to look at just how you assess in chiropractics, how you assess as a consult and an exam, full exam, and then with additional questions, or you look at the tongue, you assess through the wrist pulse points, all of those. Those are very, very beneficial to look at. Acupuncture has some great results with fibromyalgia. And then, of course, I add in, I love, as I was going through all of it, when it talked about the childhood trauma. And I don't know if I knew that part of the statistics. But when I saw it, I go, it's not about it's all in your head. But there is that element of childhood trauma that plays a part in it. And so I think that's really another avenue to go through. I just did. She was a patient of mine years ago, back in when I had the practice, and she was. I'm trying to do this without, like, and no names or anything like that. But she's a very strong Christian woman, and she was going through something that just kept triggering her, and she was having a terribly hard emotional time. Come to find out, because I haven't talked to her in a long time, she has gut problems, she has constipation, she has Hashimoto's. I didn't even know that. And then she was going through this emotional stuff in her 50s that ended up relating to when she was a child, and trauma from her mom in particular. And I mean, some really strong trauma. And as doing my shamanic work from a perspective of the Holy Spirit and the Lord and the protection that you get within that realm, we did what is known as a spirit extraction. I don't know what we call it in the church, but it's,
Deliverance.
thank you, thank you. It's literally pulling out these spirits, whether they're demons. I call it unwanted spirits, but yeah, deliverance is a great. And this woman, I mean, and it was so wonderful to be able to do this with a Christian person. And her relationship has changed with her daughter. She feels better. She feels less pain. She feels more energetic. And so that is also an element. Now, what do I talk to her about? What she's eating? Are you gluten free? She's grain free, actually. Are you eating more protein in your diet? How's your foggy headedness? All of that. There's still that nutritional element to it, and a chiropractic element. She does go see a chiropractor there as well. So there's everything. And fibromyalgia is so complex.
It's
You
so
want to throw it out.
complex. It's also all encompassing, and that's why I believe it's not just one particular treatment at one
Right.
time that's going to help the body get over it, not necessarily cure it, because uh, the person's body is what is the healer. We are coming alongside them and nudging them in that direction. I wanted to share statistically, we were talking about how chiropractic and the benefit of the adjustment. Let's see here. 45.9% of fibromyalgia patients, now, mind you, this is 1986, experienced a moderate to great improvements using chiropractic care in the treatments of myofascial pain. This was in the American Journal of Medicine. Later, they do more studies and find a 60% of fibromyalgia patients in the year 2000 experienced a moderate to great improvement with chiropractic adjustments. Now, this is in the Journal of Manipulative and Physical or Physiological Therapeutics, so
Hmm.
JMPT.
Hmm.
So that's 25 years ago, 60%.
Yeah.
And that's
That's
just
what I
with
was saying.
chiropractic.
Right. That's what I was saying. Just if you're the chiropractor that just adjusts and goes and lets them go, you're still getting amazing results. It doesn't always hit the hard ones, but you're still getting amazing results. And then looking at what you have, like, in your background and the therapies that you do. You know what is really good? You might want to include this in your array. I'm like, have you ever had the biomat out for your patients?
No, I do not have one of those.
There's a guy out of St. Louis does the original biomat that's infrared. So when they're doing another therapy, whether you do interferential or the cold laser or anything, they could be lying on that biomat and they're getting that infrared. And all it takes is like 20 minutes on infrared. So they're getting that infrared. There's a strip of stones in it, amethyst. So first of all, the infrared goes deep, and then the amethysts actually drive it even deeper. These things are amazing. And then the other thing I was talking about, these have different frequencies. So it works like microcurrent, but it also has different programs. So again, you and I just looked at it. There's programs for fibromyalgia that even drive in nutritional products for fibromyalgia through the frequency of either scalar or like a microcurrent. And this was developed by a gentleman in Germany. They use it all over Europe and specifically in Germany, but there's a whole element now in the United States that works with these Heelys. And that's all it takes. That you have where these come out and you can attach it with pads or with a wristband. And that's the other thing. Frequency healing. It's getting more and more studied. It's sort of the same thing with acupuncture. You put a needle in, it's a frequency. It's between the metallurgy in the pin with the sodium ions, which is a positive. So it works on an electrical current. But any of these frequency devices will work really well. I mean, cold laser kind of is basically a frequency.
It's interesting. Yeah, I remember having acupuncture done on me when I was in your office, and it would be great if that was available to everybody. Here in the state of Pennsylvania, it's a little bit more, I would say, harder to do as a chiropractic practitioner. You have to have as much schooling in acupuncture as I did as a chiropractor.
Yeah.
There are other states, I mean, just above us here in New York or to the west of us in Ohio or even the south of us, we can certainly utilize that because their laws are different. Uh, you know, I believe that chiropractic is a very powerful tool to help people get better connected with their bodies and allow them to heal well. And that's why we also utilize nutrition here in our office because it goes hand in hand. And that's
Yes.
why we also have physiological modalities like the stem, the laser, and so forth, because everybody's body is different. And as you said, sometimes there's trauma, sometimes there's emotional issues, NET, neuro emotional technique,
Yes, that's a
and
great
talk with
one.
them to find out, and here in our office, there are times where we have block times where I'm seeing maybe 3, 4 patients every 15 minutes, but then I also have specialty times where we're sitting down and we have those moments where it's a new patient or where it's a report of findings or a nutritional where I block time aside for those people that may need a little extra time to getting to know you a little bit better.
Well, that's a
Okay.
great part about our profession, because a Western medicine doc doesn't always have that time to establish the relationship, and that's kind of the love of even what we do. So I agree with you about that. Getting to know you, getting to
I
know.
always have a jingle in my head. It's like, Calgon, take me away. And I say that to somebody and people are like, what are you talking about? I'm
Can you
getting,
imagine saying that to somebody younger?
oh, I do. I do that. And I get weird looks like my daughter looks at me weird.
Yeah,
And just to bring up a point before we kind of take it back to, taking action to help people heal. But, my daughter just came back from Europe and we talk about Germany and stuff like that. Her experience out there was with the
where did
food.
she go?
She went to Berlin. She went to Prague, Krakow, Poland, Auschwitz, Budapest. Budapest is Buda and Pest are two separate areas separated by a nice big river.
Oh,
But it is really her experience with the architecture and the preservation. And then you and I always talk about, well, how much more advanced they are in certain areas, and not to compare ourselves to them, because sometimes we are a little more advanced in things, but yet why do we have certain standards or lack of standards in our healthcare or in our foods? or in the way that we connect with people compared to other areas where it's like, hey, we don't need these things in our food. Hey, why don't we just take our time throughout the day and just, you know, drink a nice cup of coffee or
Have a
smell the
siesta.
roses?
Have a
Have a
siesta
siesta.
at about
Yes.
what time is the siesta usually?
2 in the afternoon,
Two till
one,
four.
2 o'clock.
Yeah,
Um, there are things that we can learn that doesn't have to be, how do I say, rooted in pride, greed, money. Okay. We can connect in a much better way with people and be inspired to experience more. What's more? Abundance, whatever it is for you, whoever's watching this. You know, I feel we're so driven by money these days, or as in the scriptures, mammon. You know, striving for that success, or paying our bills, or having that American dream. And everybody has that dream of maybe being out of pain, maybe having a bowel movement where people don't and are blocked up, or maybe that better connection with your family members. There are so many different things that we can look at this that doesn't take a lot of time, and it doesn't have to be a lot of time all at once. And we have to be willing and open, vulnerable, to be in a safe place, to reach out to someone like Dr. Phyllis Russo or myself here at Bafile Family Chiropractic and my associate, Dr. Courtney Brocious. We care for people. We love people. And we want to help your body heal well, not just feel well.
definitely. I like that. You're such a philosopher. Um, I I want to add to, again, I think that the emotional component, I've been doing mental health coaching for 23 years now. And I will say it's interesting, but sometimes that's the topper. Like, the statistic you said, 60% get better with, or they get better either moderate to great, but we have that other 40%, still a huge gap right there. And I do believe, and we talk about acupuncture and we talk about like the extraneous stuff besides chiropractic, but I do believe, I think that the two most important things besides chiropractic, but especially in fibromyalgia, I'm not saying everything, but the reason why I think chiropractic is so strong in fibromyalgia is because there's such a neurologic, it's that connection between brain. We always talk about the gut brain connection, but this is connection between brain and spinal cord. And that is the next step, right? But then the next thing is things like acupuncture, which I think is important, but nutrition, what goes in, what you can do for yourself. And then the next one is counseling. The next one is being able to clear out whether it's trauma from childhood that has been the true trigger of all of this, or whether it's even triggers during adulthood. But I think that's such an important part. And really, I do want you to tell that to your patients, that when they're suffering from something deeper than just, oh, my knee hurts, but more of your chronic pain patients, because that is such a strong component to all of this.
So
Go
we
ahead.
can there's taking action to heal. And what you said is really good nervous system flow and communication, good nutrients and reduced toxins in our body, improved posture. I mean, how many times do we see anybody today with their posture like this constantly all the time?
Yes.
Okay.
I never do that.
Getting your joints moving, so more oxygen to flow well, by benefiting us in many different ways, decreasing the chance of arthritis, decreasing your feeling of pain, decreasing depression, and reducing the chronicity. We got to move. We got to get out there. One thing that I wanted to talk about, but we're going to do this at another time, is the benefit of getting outside, having sunshine. vitamin D, not just vitamin D, but just being outside. So many people today, ever since this thing that happened like 5 years ago, uh, have isolated themselves. I mean, how many
I
people are
just,
working from home today and
yeah.
not congregating with people? I mean, isolation kills.
Oh, I was like, somebody was just talking about that. I'm like, who? It was my pastor, because he was talking about community. He was, we were talking in Acts 21 and about how they would go from city to city to city and find their brothers in each city. How important that is to keep us uplifted, to keep us connected to our source, to God, to Holy Spirit. It isn't, it's hard to do when you're isolated. I work out of my home, so I know it. And I try, I mean, I have tried to get out, haven't for the last 3 weeks, but I do. I try to get out. I'll network, not just to network and say, hey, this is what I do, but I network just to see people. I mean, I have 4 cats and that's pretty cool, but you can only talk to them so much. They don't always talk back. I mean, they do. It's a meow. I don't always understand it though.
My dog talks back too. She'll bark at me to tell me, hey, it's time for my chew or to go outside or play with me. So it's
It's
really
limited.
it is limited, but the key is listening. When we rearrange the word listen, that means silence. So we have to be able to pause and pay attention to those that are around us, whether it is our furry animals or those that we are connecting with, because sometimes we don't listen, and that's very, very
True. I'm
important.
so sorry. If you see me looking, Max is having this field day with a little tiny ball. And I don't usually see him get all excited about the ball. And I have a million balls in this house. I have one we call the crazy orange ball. Again, I don't know if he really knows every time I say crazy orange ball, if he knows what it is. But it is crazy. Like you switch that baby on and it goes, it whips, it will go to my bedroom from the living room. It'll go downstairs. It's crazy. Anyways, sorry. I got 4 cats. It's what I talk about.
That's all right. So healing takes time, no matter how we're looking at dealing with fibromyalgia and all that we can do. Years of effort, understanding by family members, willingness to work beyond our pain, realistic expectations. How many times have we had patients interactions with practice members where they want to be out of pain like that because they've been conditioned that you can go to a doctor, get a prescription, go get it, and start taking something and feel different.
Take a pill.
Take a pill.
It'll help you immediately, but it doesn't always anyway. Um, just make sure it's not all
In
in
your
your.
head. But really it's a combination of needed of taking responsibility and control over your own outcomes. And there's hope.
Oh, I believe very strongly. That's one thing as a practitioner, maybe I'm guilty of too much. I'm like the patient where my hope is always you're going to get 100%. Probably need to back that down a little bit just because the human body is the human body.
Well, when we set goals, and I do that as well with patients,
But
we shoot for the moon. If we miss, at least we hit a few stars along the way. That's how we have to look at it.
you're so good with those analogies.
It's what I do.
That's what I love. Well, this has been fun again. This was been very joyful today. I loved it. And I hope this helps people listening. I really do. This is
If anything, in the realm of trying to help somebody, it's when they take the time to listen to us go back and forth and many different ideas of what our experiences has been, they take something away. If it's one thing, there's power in one. And in that one thing, that can be a seed to move you forward and experiencing a different harvest of what you've been trying to cultivate in your garden. So this is always fun. I love connecting with you,
Yes.
Phyllis. I
And
love putting
please, I
our,
do too. I know we haven't done it in more than, it's been like 3 weeks or something
yes,
like that. So I just know that I missed you as always. And just really any of your patients, if they need to get a hold of me, I don't care. Give them my personal number. Just have them text me and we can just sit and chat. But always remember that they can look on the website, dr-livewell.com, or hashimotoswarrior.com, either one. But just know that I'm there for them and I want them to know that. Yeah, it's always nice to get a confirmation.
that's right. And confirming that it's not all in your head.
Told
We'll
you.
see. We'll see you all next time. Thank you for tuning in. Thank you, Phyllis. We love you so much. Have a great day.